Ago, the Ministry of Health launched a program to test people from various places, especially focusing on areas where crowds of people convene, such as bus stations, markets, motorcyclists, among others. Dr. Sabe Nsanzimana, the Director General of the Rwanda Biomedical Center, says the results from this testing are promising.
Mu byukuri navuga ko muri ibyumweru bibiri bishize twabonye impinduka.
Truthfully, these past 2 weeks, we've seen a difference which is promising. The understanding of the pandemic by the people, such as wearing masks, and all that is showing results. We had challenges in markets and in overcrowded places. We also suspected in the public transport sector and among motorcyclists. But the numbers we have currently, they show that the rate of infections has dropped in the markets as well.
Byagabanutse no mu masoko iyo mibare nkubwiye nayo iraduha icyizere.
Currently, the testing of different groups of people continues in churches and where sports activities are being held. Habimana Francois is a resident of Nyarugenge district who was tested when he had come for prayers at St Michel. He says this is an important thing to do. This builds confidence among people about their health and knowing where they stand. I have welcomed this well because we need to know where we stand, especially because we meet with so many people. Pastor Antoine Rutaisire from the Anglican Church of Rwanda, which is among the churches where the testing is taking place, also said they are instrumental in working with government authorities in disseminating information for prevention against the spread of the pandemic. Even before they came to test us, this was also our initiative, and we encourage the congregation, telling them to own the responsibility of protecting themselves from the virus, because the government doesn't benefit from telling us to protect ourselves, and we are all part of the government, so it benefits all of us. Dr. Sabe Nsanzimana says that although the number of people infected with the pandemic is declining, no one should be complacent, and hence why there is random testing in churches and sports activity centers to ensure the virus is not hidden anywhere. We've seen a decline in infections from the past days, but even with a decline, it doesn't mean the virus is completely gone. But we continue to search and see if it's not hiding among a certain group of people, such as those doing exercise during car-free days in churches where many people meet. So I would say it's like we are conducting research for us to find out how the pandemic stands among the people that are going on with their day-to-day activities. 2 weeks ago, the number of people infected with the COVID-19 fell sharply, according to the Ministry of Health, which said the decline was based on the fact that Rwandans already understood the importance of adhering to the guidelines, such as wearing face masks, hand sanitizing, and social distancing, where many people meet. However, Rwandans are reminded that no one should be complacent because the pandemic is still present, and one mistake could change everything considering the nature of the pandemic as it transmits quickly.